So this is interesting, and I'll just place it to whoever's the best to answer it. I let you guys be the experts as always. But when members transition from military to civilian healthcare, what I'm wondering is who's in charge, or is anyone in charge, of educating the healthcare system that is receiving them on the cultural and military awareness? It seems like it's a very specific reality. And I think it's in the United States where healthcare just is seamless between, the CAF or the service and then when you become a veteran. And so I'm just wondering, is anyone in charge of it? Is that a gap? And is there a place that would be best served to do that role?
Mr. President, yes, this is still a gap that is slowly closing, though, I would argue. First, we need to realize that there's a majority of our members that are releasing in areas where there are lots of members releasing, because usually they live nearby a base or wing. And the community gets familiar with our members as a result of that because they see more of our veterans, I guess, in those locations. That's not the case, obviously, if a member decides to release remotely, and that's where we have challenges. In order to address those challenges, we've recently worked with Veterans Affairs and the College of Family Physicians of Canada to develop a guide, a best advice guide, that's how they call it, where they help family doctors in the community to understand better what it is to be a veteran, what our military members are going through during their career, what type of stressors they are exposed to, what type of conditions they develop as a result of those stressors, and how to best take care of them. But also what are the resources available to them after release. And that goes for the different support and healthcare resources that are available. Therefore, family doctors out there are able to make sure that the members are offered, the veterans are offered the best support possible where they are in the country. Are there still gaps? Of course, there are still gaps, but I believe we're moving towards an improvement, I guess. And my colleague in Veterans Affairs is definitely making a lot of efforts trying to address that.
So is there a feedback loop? What I mean by that are veterans and women veterans reviewing this advice and then giving feedback to see if it actually is effective in its delivery.
It was done in consultation with... Sorry, Mr. President.
I just asked for the response to be quite brief.
So it was done in consultation with former members. So some veterans were involved in the consultation on building that document. And feedback will be collected through surveys like Veterans Affairs do on a regular basis to seek the feedback and see if there is an improvement to make.